So today I'm so pleased to bring this session to you titled Advancing Patient-Oriented Research Priorities in Adolescent and Young Adult Oncology. And we have two presenters today that are going to walk us through the work that they've achieved. And I'm sure we'll have a very robust question and answer period afterwards. First is Dr. Perry Tettleman, a clinical psychologist and assistant professor in the Department of Psychology in the University of Calgary. So she just is down the hall from me, and we get to collaborate on a regular basis, which is really exciting. Perry holds the chair in transdisciplinary digital mental health. Her research is centered at the intersection of psychosocial oncology, pain, and mental health, and is focused on developing novel patient-oriented digital interventions to support the well-being of children, adolescents, and young adults diagnosed with cancer. And she works closely with patient partners to co-design research that addresses what matters most to patients and families. And with Perry, we also have Nadia. Nadia is a native of Montreal, a graduate of McGill, and today she is the Vice President of Leadership Giving at the Canadian Cancer Society. And she is also an AYA cancer survivor. So in 2021, she was diagnosed with triple negative breast cancer and navigated that journey during the pandemic with two young children. She is now cancer-free and deeply committed to advancing AYA research and care to ensure that others facing this disease receive access to the most promising interventions and personalized care and support that they need. So with that, I'm so excited to hear today's talk and to be part of this with all of you. So I'll hand it over to Perry and Nadia.
Thank you so much for the introduction, Linda. It's so great to be here. I was telling Linda that I think I presented in this webinar series pre-pandemic 2018 or 2019 as a PhD student, and it's great to be back now as a faculty member talking about how my work has evolved since that time, and so pleased to be co-presenting with Nadia. We had a chance to work together on the Adolescent Young Adult Priority Setting Partnership. I've learned so much from her. Um, and yeah, so we're excited to tell you about our work. I'm going to get this screen all lined up here. Um, Perfect. Does that look good? Yeah, okay, awesome. So as Linda said, my name is Perry. I'm a new assistant professor at U of C at the University of Calgary, and fortunate to also be embedded in the new Arthur Child Comprehensive Cancer Center, which is incredible. If you haven't been, highly recommend coming to visit. We're actually hosting the Canadian Cancer Research Conference in this fall, and I suspect there will be some great opportunities to see the building. So if you are around, feel free to reach out. And pleased to be here with Nadia.
Thank you, Perry. Wonderful to have the opportunity to work together again and present the work that we've embarked on and seen through for the AYPSP. I think my introduction really gave everybody a great oversight as to, my role here and why this matters to me. But in short, again, in 2021, I was diagnosed with cancer, and I'll tell you a little bit more about my personal journey shortly. And through that experience, of course, have really found, of course, a deep meaning and passion behind the need to work towards advancing the unique needs for AYA cancer patients, whether they're living with or living beyond the disease. And of course, anybody who has lived experience throughout that very particular and unique experience. So happy to be here today to be sharing our results with you, to be sharing some of our observations with you, and really, of course, delighted that you're all joining us because you ultimately care about the cause and want to do something about it within your own scope of work. So thank you.
So we're here today to talk about adolescent and young adult oncology. Adolescents and young adults are an oncology population generally defined as being diagnosed with cancer between the ages of 15 to 39 and being increasingly diagnosed recognized as a unique cancer population, both medically and psychosocially. And unfortunately, we're seeing rising rates of cancer in adolescents and young adults. It's really becoming a national and international crisis. Between 1992 and 2013, there was an increase in the age standardized incidence rates of cancer for AYAs, while we've actually seen the rates of diagnoses decrease in older age groups. So we're starting to see these alarming trends both in Canada and abroad. And this is really starting to get attention in the popular media as well. Just earlier this year, the Globe and Mail published a feature article really highlighting the rising rates of cancer in adolescents and young adults and documenting the really unique and devastating impacts of cancer on this age group for people who are generally pursuing their education or their career, starting to think about building families and their peer groups. Really unique and important group to be thinking about. It seems like almost daily we're hearing about notable young people diagnosed with cancer in the popular media. And it could really touch any one of us. We know that nearly half of us in this room will be diagnosed with cancer in our lifetime. And that was the case for Nadia.
Thanks, Perry. So a little bit about my personal story, my personal journey. Um, as the not poster child, but in this case, poster child of what a cancer story looks like. Back in June of 2021, I was diagnosed with triple negative breast cancer. I have no family history of the disease. As I learned, no genetic markers that predisposed me to the disease. And I was probably at the healthiest I've ever been in my life, having just had my second daughter, but being very active and leading a very healthy lifestyle. And of course, then the devastating news came that I was inaugurated in this lovely and exclusive club that nobody wants to be part of. Um, to say that the news and the diagnosis rocked my world, shook my foundation, and that of my family is an understatement. And of course, you add to that the fact that I was diagnosed in the pandemic. So we were navigating very uncertain times, very trying times for people who are navigating the medical system, in that you had to actually encounter much of that journey on your own and unaccompanied. So facing unique challenges in and of itself. And then add to the fact that as a young adult, a healthy young adult for that matter, in many instances, whether I was going to get follow-up appointments, post-diagnosis, regular sort of monitoring done even since my experience with cancer, whether it was in subsequent mammograms or ultrasounds, for example, hearing the comments that don't worry, you're young, this doesn't happen to you. So it really kind of pointed me to navigating what cancer looks like as an AYA in a very unique setting. Being the youngest person in the oncology department, coming in to get my infusions, as you see in the pictures here, cold capping as well. But nevertheless, losing my hair, having to take a pause on my career, reevaluate what it was I was doing, what short and long-term planning could really look like. And so for me, it became, as much as it was completely life-shattering in the moment, once I started navigating the system, once I started navigating my own journey, I made a very conscious choice to lean into that process. And for me in particular, I felt compelled to lean in and to lean and lend my voice to the cause. It became apparent to me, as you might imagine, the world works in very unique ways sometimes. I was, at the same time as I was diagnosed, actually headhunted for my current role with Canadian Cancer Society. And the universe was just speaking to me very loudly and saying that there was something that I needed to do here. And there was strength and there was opportunity within this very challenging time. And so since then, now cancer free, and living my life with a renewed perspective on things, I've dedicated much of my time in a volunteer capacity to work with various boards and even the AYA-PSP, which was an 18-month mandate. And then since then, of course, continuing to work closely with Perry on opportunities like this to share my story, to put a face to what cancer looks like in an AYA context, and to really open people's eyes to what the unique challenges look like. And I think ultimately, as we'll see shortly, why it is that that patient or lived experience perspective is so important to shaping what a research portfolio and agenda looks like in order to ensure that what we're seeking to unpack, to learn, to grow from is relevant to the population that is, in fact, facing these really difficult times.
I've been so fortunate to be able to work with Nadia throughout this process. And as I mentioned, I've learned so much from her about the unique needs of young people diagnosed with cancer, but also I've learned a lot from her professional expertise in how we communicate our science, right? And make it meaningful and relatable to the public. And we can talk about that later, but I think that is one of the beauties and powers of patient engagement in research too. And so much of my research over the past several years has focused on understanding the psychological and social needs of AYAs diagnosed with cancer. And while there is really growing research in the field, which is great, AYAs are still part of a really underserved cancer population. The Canadian Cancer Society released this report on underserved communities, and adolescents and young adults are actually highlighted as one of the groups that continue to have needs that are largely unmet and unaddressed in the cancer care system. And part of the reason for this is that, there is a lack of research in adolescent and young adult cancer, comparatively speaking to cancer in other age groups. The Canadian Partnership Against Cancer estimated that between 2005 and 2013, only 0.4% of the total cancer research investment in Canada was for AYA specific cancer research. And this amount has not increased since that time. I'm actually working with CPAC now to update these values so we'll have a better sense of where things are and how things may change as a result of the priority setting work that we've done.
And so I think that brings us to where we see this lovely synchronicity and the importance to have a conversation between the research community and the community that is impacted. And that would be, again, people who've had the opportunity to go through this experience as a patient, but even caregivers and other people within that environment who have a very unique understanding of the lived experience. So while we're incredibly encouraged by the fact that there are conversations now about developing agendas for AYA cancer, specifically dedicated funding to address the fact that there is a growing rate of incidence and that there's way more for us to unpack, to learn, and to understand, that patient voice and having that lived experience be part of that ongoing dialogue is going to be so important to shape that portfolio, to really understand what those unique needs are and how, again, we can continue to move forward in a way that is relevant and that will be meaningful for the community that it will impact at the end of the day. So as an example, very quickly, Perry, one of the troubles or one of the challenges that I have heard many of my peers navigate, and through serendipity, I was able to kind of work around myself, was even in the early stages of diagnosis. And I know we'll talk about this later, but really navigating the medical system and having access to screening. So again, we'll talk about that later, but that certainly comes out as something that many AYAs have struggled with, myself included, just in terms of how we're taking seriously. And as an example, even post-treatment, when I had a bit of a complication about a year out of treatment, my oncologist had written a paper, a requisition for me to go in for a mammogram and ultrasound, indicating that it was urgent. And when I called the clinic to get my appointment, they indicated that I would have to wait, that I would be seen first by a technician to have a mammogram, but that they would assess whether or not there was a true need for an ultrasound. And this despite the fact that my oncologist indicated that it was urgent and that I had an experience only 12 or so months prior. So really having to advocate for yourself in those unique circumstances and having to navigate the system is a really burdensome experience for patients.
I think, exactly what Nadia shared is a sentiment shared by quite a few young adults that the lived experience is not always reflected in the research that's done and how we prioritize what's being done on the research side of things. And so when I started my fellowship, I was familiar with the James Lind Alliance, which is a nonprofit organization based in the United Kingdom that's developed a method that brings together patients, caregivers, and healthcare professionals to establish research agendas that are really based on the needs and experiences and preferences of people with lived experience. James Lind Alliance priority setting partnerships ultimately result in a top 10 list of research priorities in a certain area of health. There's been over 200 completed or in progress around the world. And I saw a really unique opportunity to bring this method to AYA cancer in Canada. There was a lot of momentum building with interest in AYA cancer. And I saw it as an important opportunity to be able to say, hey, how can we incorporate and really center the voices of people with lived experience? And it was important to me that this work was done in a partnered way right from the start. And so once I had the idea for the PSP, I reached out to Chantel Thurston, who is an incredible AYA patient advocate and the chair of a Canadian-led patient advocacy organization, AYA CAN, that Nadia is actually also on the board of. I hadn't known Chantel before this. I sort of cold called, sent her an email, and was like, hey, this is my idea. And we met and started building a relationship. And fortunately, she was on board and we wrote the grant together. We submitted to the CIHR planning and dissemination competition, and we were fortunate to be funded. I was also fortunate to have the support of my fellowship mentor, Fiona Schulte, and together we co-led and co-designed all stages of the priority setting partnership. And so just to give you a very brief overview of what the steps of the priority setting process involved. It's actually a very prescribed process. There's a guidebook that you need to follow when you're doing a priority setting partnership. And to actually follow the process, there is an advisor from the James Lind Alliance who attends all meetings and really oversees all aspects of the work to make sure that it is following the guidebook and that the values of the JLA, so things like transparency and equal voices, are embedded throughout. Every PSP is overseen by a steering group. So the first step is to set up a steering group of people with lived experience, and we'll talk about that in a moment. You then capture the perspectives of the community at large in terms of what they'd like to see answered by research. You take that data back, process it internally, come up with summary questions that represent the responses that were captured in the survey, check the existing evidence to see if any of those questions have already been answered by research, send those questions back out to the community in a second survey where they're asked to rank them in order of importance. And then the top ranked questions go to a final priority setting workshop where the top 10 is finally reached through consensus.
So, as Perry noted, the AYA Cancer PSP was really led by a steering committee or a steering group, as is the usual sort of protocol for all these types of endeavors. We set out to identify a steering group that was robust and representative of people, again, with lived experience and clinicians who have, in one way, shape, or form, of course, a link back to the topic at hand. We had many people join us. We've had bereaved partners. We had people with lived experience living with or living beyond, as was my case, as well as people from various parts of the clinical operation side. We recruited the steering group actually through an open call for expressions of interest. So in my case, I saw a post on LinkedIn, I believe we're going back 2 or so years ago, and again, felt compelled to apply to share my interest and my unique experience, as well as having a professional background that I felt had a certain relevance that could be applied. And I was very happy and delighted because I know that there were quite a few applications that came in that I was selected to join this group. So ultimately, as you see here, we had 16 members. And really, we were facilitated and guided by a fantastic group, our project coordinator, of course, Perry, who was there, as well as others. So we worked through the process over approximately 18 months, culminating in like a final working group, which we'll share shortly. But really starting at building the foundation. So going into things such as just having a definition of what AYA really would look like. And then, having various tasks such as co-creating surveys, abstracting into summary questions, and other items that helped us in developing a robust outcome at the end of the day. We had as well with us, of course, a research team that backed all of this. And please feel free to jump in on this one, Perry, because I know these are folks that have worked very closely with you. But of course, a number of researchers who helped us, I think, more from a professional lens with content and methodology expertise for AYA cancer to ensure that we were well guided by subject matter experts at the end of the day, and ensuring that what we were coming out with as an outcome was relevant. And finally, we did have about 30 or so cancer organizations and charities who partnered with us, who were actively engaged at various levels throughout the process. So many of them we've had subsequent conversations with, either in promoting now the outcomes of our work or engaging with us by sharing and promoting some of the surveys that we had over time. So many of them, as you see here, just have a vested interest, as we know, in pushing forward the research agenda, ensuring that it gets promoted, and ultimately that there is action that follows as a result of the work that's come through the PSP.
Exactly. And it was important to us to be inclusive throughout the process because we wanted to ensure that the priorities that emerged were ones that reflected the community broadly. And so that's why we recruited the steering group through an open call for expressions of interest and why we partnered with community groups to ensure that we were reaching folks beyond those that generally participate. And so the first step of the steering group was to define what we meant by AYA and what the scope of this work would be. And we settled on the CPAC definition of AYA, which is those diagnosed between 15 to 39, as well as caregivers or loved ones of AYAs. Interestingly, throughout the project, caregivers didn't really seem to resonate with the AYA group. It's more commonly used in other PSPs, but we had to shift the wording throughout to ensure we were capturing the perspectives of those who were partners or parents or siblings or friends, and as well as clinicians. We published the protocol in Current Oncology back in May 2024. It was a great opportunity to work together with the steering group to do this, and we've now submitted the final manuscript, so hopefully we'll have an update on that soon. I wanted to give a quick shout out to a resource that I was fortunate to help develop with Chantel and some other patient advocates to support the engagement of people with lived experience in drafting manuscripts and reviewing other written work like grant applications, because we're increasingly doing that, and it can be hard to know where to start. So we developed some checklists and blog posts to help support this practice, and those are freely available online, so feel free to check them out. Just to give you a brief summary of the results by stage of the project, we had nearly 2,000 questions submitted as potential priorities. When we did our analysis, we summarized those into 58 summary questions, checked the existing evidence. None of those 58 summary questions had been adequately answered by research. And so all of those went to the second survey, where we were then able to select the top 20 ranked questions of those 58 to move forward to the final priority setting workshop, where we reached consensus on the top 10. And so we had the final priority setting workshop in November 2024. It was attended by 23 participants from across 7 provinces in Canada. We're pretty proud of the representation that we got. Again, there was a call for expressions of interest to join the final workshop, so really wanted to capture a range of experiences. And so, through a series of large and small group exercises that the advisors from the JLA led us through, by the end of the 2-day workshop, we reached consensus on the top 10 priorities. And I will let Nadia briefly share those with you.
Thanks again, Perry. So this is the exciting part, what kind of came after many, many months of work and deliberation and working through, as you saw, a lot of really important feedback that we received. And ultimately, we landed on 10 priorities. So the first that came through was really focusing on delays in cancer diagnosis. So again, how do we improve that experience for AYAs? So that could be screening as well. Number 2 is improving access to healthcare services for AYAs in a really comprehensive way. So from primary care all the way through palliation and rehabilitation, psychosocial support before, during, and after cancer treatment. Number 3, AYAs care about enormously about how we can improve the development and implementation of novel treatments and testing protocols to ensure that we reduce risk, of course, that we understand where there's risk for recurrence, and also that we're able to screen and diagnose at the end of the day much earlier. Number 4, another very unique experience for many in their AYA journey is around family planning, given that very crucial time in life. So fertility and family planning experiences came up as one of those 10 priorities as well. End-of-life care, needs and preferences of AYAs with cancer and their families, and we'll speak about that a little bit later. Number 6, the impacts of cancer diagnosis on mental health for AYAs and how we can continue to better support AYAs in that journey. Number 7, challenges related to transitioning off of treatment and living beyond cancer. So really, again, particular focus around those unique challenges for AYAs in a very important stage of life. So considering things like returning to work or school, reconnecting with peers, and rehabilitation. Number 8 was monitoring, so long-term for cancer recurrence and secondary cancers. Number 9, financial impacts. And number 10, again, coming back to this notion of diagnosis, it's improving screening, access to screening and early detection for AYAs in the general population.
And so we're really proud to see that the questions really span the full cancer continuum from screening and diagnosis to treatment survivorship and end of life. And we also see questions that cross all the pillars of research, really from that basic fundamental science, the treatment and testing protocols, thinking about drug discovery, all the way to psychosocial issues and health systems and policy research. And so we really see this now as the agenda that will drive AYA cancer forward in a way that aligns with what patients, families, and clinicians have told us is important. We're really proud to have created a video summarizing this process. And so we will share that with you now. Nadia, if you could give me a thumbs up when I play just to make sure the volume's working, that would be awesome.
Every year, over 9,000 Canadian adolescents and young adults known as AYAs, those aged 15 to 39, are diagnosed with cancer in Canada, and this number is rising. For AYAs, cancer disrupts a pivotal stage of life, and they face unique challenges across the cancer continuum. These challenges have resulted in poor outcomes for AYAs compared to other age groups in key areas like mental health, physical health, and even survival. To improve outcomes, we must begin to prioritize research that matters to AYAs and their loved ones. Over the course of 18 months, and using the James Lind Alliance framework, the AYA Cancer Priority Setting Partnership brought together patients, carers, and social and healthcare professionals to work alongside over 30 Canadian organizations to identify the top 10 research priorities that would improve care for AYAs. An online survey was completed by AYAs, their loved ones, and clinicians from across Canada to gather what was most important to the community. From this survey, over 1,900 submissions were collected, which were then distilled down to 58 potential priorities. The team then rigorously reviewed these potential priorities to determine which were already answered by existing research. Once completed, a second survey was conducted to rank their most important priorities, distilling the list from 58 down to 20. The top 20 ranked priorities were then discussed at a final priority setting workshop where a consensus of the top 10 was finally reached. These resulting 10 research priorities encompass key questions that span the entire cancer continuum, from screening and diagnosis, to treatment and care, to supporting patients at end of life, and those living with and beyond cancer. But identifying priorities is just the beginning. Now, we must act. By designing research that matters to AYAs, securing funding, and turning findings into real-world solutions. Together, we can make a difference for AYAs diagnosed with cancer in Canada. Let's shape a future where every adolescent and young adult with cancer has the support, treatment, and care they need to thrive. Learn more at thrivelab.ca.
I love that video so much, if I can say. It's a really great summary of the work that's been done, there's a lot of love and care that's been poured into the process. But just as the video states, we don't stop there. It was an incredibly important step in the process, but the work continues beyond identifying what that top 10 looks like. And so we've kind of distilled it into 4 pillars, if you will, that will be, we feel, really important in continuing the conversation and ensuring actionable next steps throughout this process. And I think it's really important to note in this as well that what's important here, because this is such a unique patient population, because there are still so many unknowns, is that we work together, that we're breaking down those silos, that we're creating space, and that we're open to really working together in a cross-functional capacity to ensure that we continue to advance the work that's been done here. So I'm really encouraged to see where we've landed, and then to dream about where we can go together through continuing to advocate for the cause and building awareness and having conversations, to thinking about and setting aside concrete financial investment opportunities so that research can actually take place and happen. And then thinking of it from even an implementation perspective is, what does that look like in a clinical setting? How do we continue to talk about it, continue to improve, and again, work better together to advance?
And so briefly in the last sort of 5 to 10 minutes or so, I want to share a little bit of new work that's launching out of my lab to address two of the priorities that came out of the PSP, and certainly, always open to collaboration and ways to work together because, as Nadia said, moving these forward is going to take collaborative, transdisciplinary efforts. And, as Nadia alluded to, one of the big challenges experienced by AYAs, and something that I heard quite a bit in my clinical work, that the AYA cancer journey often looks a lot like this. Lots of winding roads, lots of question marks, lots of needing to learn on the go and navigate a system that is often quite fragmented and quite new to young people. And that this really impacts the trajectory of someone's cancer experience. And knowing that there are likely ways to streamline and help get folks the resources and care and navigation that they need right from the start.
I was just going to reiterate the same, Perry, as we know, and this is can be broadly said, but that cancer experience is unique for everybody. And I think it's just so important for us to see just how challenging it can be and often is for AYAs who are living this experience. And as a result, think about how it is that we can change the systems and how we can provide better support for people who are navigating this journey.
And so we were fortunate to receive here in Calgary one of the 2024 Arthur Child Catalyst grants to work together with AYAs to co-design and implement a new intervention, which we've called Anchor, which stands for Addressing Unmet Needs in Cancer Health and Supportive Care for Newly Diagnosed Adolescents and Young Adults, to really help bridge some of these fragmented gaps in navigating the system and helping people get connected to the supportive care needs and services that they may need throughout their journey. And so we're fortunate to have a really robust team working with us on this project, including Linda Watson and her team. Really appreciate her support and backing of this work, and also highlighting the importance of, research and operational synergy, and how we need to work together to tackle some of these pressing issues. The team is also supported by two patient partners, Megan and Lance, who are co-creating this with us every step of the way, and Sierra, a new research associate who has started with my team and is taking the lead on moving this work forward. We envision that this intervention, will be delivered to all AYAs newly diagnosed with cancer in Calgary, and that will fit as part of a stepped care model for supportive care services. Because it's co-designed together with AYAs, we don't have all the components nailed out yet. Those will be decided together with patients, but based on a needs assessment that we completed, we envision that this intervention will incorporate components like helping AYAs navigate the system, providing information and education on the different supportive care services available and how each discipline can help support in their unique way, some psychoeducation on the emotional impacts of cancer and initial coping skills that patients can use on their own. How to become your own advocate. We've heard from Nadia and many others how important it is to advocate for yourself in the system, and that can feel really hard for young people, especially if this is their first, big medical experience. And then also some information on, managing AYA specific concerns like parenting, navigating leaves from work, navigating cancer in school. Those are all very common concerns that we hear, and not every young person will need one-on-one support to manage those concerns. We can provide some of that information universally to everybody. So as I mentioned, we completed a needs assessment and we're just gearing up to start phase one now, which is the co-design and usability work. We'll then implement the intervention within the healthcare system and evaluate both effectiveness and implementation outcomes. And then we're really excited about thinking to the future and how we might be able to spread and scale this across the province to some of our community-based oncology sites and as well to Edmonton. So in our last few minutes, I wanted to just talk about some other work that is just getting off the ground related to priority number 5, end of life care needs and preferences for AYAs. And so this is a quote from the CPAC report on adolescent and young adult cancer shared by Bronwyn, who was actually one of the founders of AYA CAN. And what Bronwyn shared is that other people don't know how to talk with you, especially if you're terminal. You'll survive, is all they say, and do not talk about how it feels to be facing your death every day or how scary that is. So I felt such isolation. And I hear this from young people all the time, right? That it can be really hard to have some of those difficult conversations about prognosis, about end of life, about their wants and preferences should things not have a favorable outcome. And the reasons for this are multifaceted. Patients often tell us that, they believe the healthcare provider should be the one to initiate these conversations, but then healthcare providers say, oh, well, I don't want to upset the patients by bringing up these conversations. And then unfortunately, what happens is that there's a conspiracy of silence. AYAs often feel isolated and stressed, having these thoughts and feelings around, end of life care. It's something that AYAs find important, and even if there is curative intent, of course, it's something that people think about, but not something that is often actively discussed.
Happy to just jump in and share. I think Bronwyn's quote, it says it all. But that is definitely something that is a challenge to navigate as an AYA, or potentially anyone even navigating the cancer journey. In that it's the big taboo. No one knows how to address it. No one knows how to talk about it. And as a result, you get very little support in navigating something that is a distinct possibility, and then the unique needs around planning around that. So I've obviously been incredibly fortunate in that I'm a survivor and cancer free. But in early days, especially before you have a final diagnosis, or even when you do, and you come face to face with the notion of your own mortality and what that means and the vacuum that might be left behind, it is so important, I think, to have the support systems in place. I think even for family and friends to be able to navigate those conversations and provide support in a relevant and sensitive way, but even for healthcare providers to really overcome that taboo, to provide the resources necessary, and to address ultimately something that is a very real part of the diagnosis.
My colleague in the US, Lori Weiner, developed a communication tool for AYAs and their loved ones and healthcare teams to talk about some of these end of life, serious illness conversation topics. It's called Voicing My Choices. It is a workbook that has 10 modules that cover different topics relevant to adolescents and young adults around navigating some of those end of life conversations. So, of course, it has different modules related to life support needs and preferences, the intensity of care desired, different types of medical care decisions that might be important to somebody. But it also has topics related to young people as people and how they would like to navigate their life, their legacy, if they are to die. And so things like how they would want to be remembered, what would they would like done with different belongings that have meaning to them. If they have children, what they'd like to say to their children if they were to die. Um, and Lori has studied voicing my choices quite extensively over the last 20 years or so and has found that it's really feasible and acceptable by patients and actually improves patient-reported outcomes in terms of reducing anxiety about death and end-of-life conversation, but also reducing outcomes like decisional regret for caregivers, knowing that they will have acted in a way that's important to their loved ones. And so this has been around for quite some time, but it's not used quite broadly at all in Canada. And there's a number of reasons for that. Number one, the American version is you have to pay for it. And number two, it doesn't capture all the aspects of the Canadian cancer experience. And so we actually received funding, some seed funding from the Pan-Canadian Palliative Care Research Consortium to adapt voicing my choices to the Canadian context. And we're working closely with patient partners, Canadian Virtual Hospice, and clinicians from across the country to start doing some of this work. Coming down the pipeline in the next couple months, we'll be recruiting adolescents, young adults, and clinicians from across Canada to take part in some focus groups and interviews about what they think would be important to include in a Canadian version, and then some exciting plans down the road to think about how we might be able to embed voicing my choices within the healthcare system and help train patients and also healthcare providers to engage in some of these conversations in an important way. And I've had some initial conversations with some clinicians here in Calgary who are really excited to hear about a tool like this coming down the pipeline because it is a big challenge and area of moral distress for clinicians around navigating some of these issues. And so just to wrap up, I'll pass it over to Nadia.
Thanks again for that, Perry. I think that, wrapping up comes back to this slide for a reason, because now we're forward focused. Now we're thinking about what we can do and how we can continue to carry this conversation forward and what the actionable next steps look like. So as Perry has demonstrated, there is work that is ongoing. We're continuing to engage with the population, the AYA cancer population, but importantly too with organizations that care about the cause, that can promote some of this work, and the research community to come together to continue to talk about and envision what programs can look like in the future and what investment, importantly, would be needed in order to be able to really light a fire under it and get it moving. So we're really looking forward to seeing that turn into action and continue to really make a difference for people who are facing AYA cancer.
And so with that, I'd like to thank all of those who have made this work possible and continue to make this work possible. Nadia, for being here today and sharing your lived experience. And of course to AYA CAN for their support. And if you haven't joined their newsletter, please go and sign up. They host some really important community events in the AYA space. And so with that, we will be ready for questions.